Hi, my name is Tessa Renzi. I'm going to present on benzodiazepines today. So, benzodiazepines are classified as a depressant drug, meaning that they operate to slow down the nervous system and may cause sleepiness and relaxed mood. Benzodiazepines are only available legally from a doctor's prescription, and they're a classification of drugs that people do seek illicitly sometimes. So benzodiazepines are commonly used for anxiety and panic, as well as seizure disorders and insomnia. Benzodiazepines are commonly called benzos, so I'll probably use that sometimes. Benzos are treat symptoms including decreased need for sleep, racing thoughts, unusual talkativeness, agitation, and distractibility, and those are common symptoms of anxiety disorders. So here's a little video.
Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I will discuss benzodiazepines. Benzodiazepines are a class of drugs named for their chemical structure that are commonly used to treat anxiety disorders and sleep-related disorders. They include well-known drugs like Valium, Xanax, and Klonopin. There are dozens of drugs in the benzodiazepine class, but the mechanism by which they all exert their effects is thought to be similar. The sedating and anxiety-reducing effects of benzodiazepines are believed to be attributable to the drug's actions at receptors for the neurotransmitter gamma-aminobutyric acid, or GABA. In particular, benzodiazepines act at a subtype of GABA receptors called the GABA-A receptor. GABA-A receptors that also bind benzodiazepines are sometimes called benzodiazepine receptors. When benzodiazepines bind or attach to the GABA receptor, they bind at a location separate from where GABA itself binds, and exert an influence over GABA binding. This type of action is called an allosteric effect. In the case of benzodiazepines, it results in the increased action at the GABA receptor. There is not complete consensus on exactly how benzodiazepine binding affects activity at the GABA receptor, but there is evidence to suggest that it increases the likelihood that GABA binding will activate the receptor and/or increases the effect that GABA has when it binds to the receptor. That effect is to open an ion channel and allow the passage of negatively charged chloride ions into the neuron. This influx of negatively charged ions pushes the membrane potential further from zero, or hyperpolarizes it, and makes it less likely the neuron will fire an action potential. This type of neural inhibition is the basis for the effects of benzodiazepines, for by inhibiting the activity of neurons that make up networks involved with anxiety and arousal, the drugs are able to produce calming effects.
Yeah, so that's just a little bit of the neuroscience behind benzodiazepines, and the most important thing to take away from that is that benzodiazepines work to slow down the central nervous system. So for those with anxiety, the central nervous system can be overactive. So when the benzodiazepine affects GABA, it slows down the central nervous system back down to like a normal level.
Welcome to 2-Minute Neuroscience, where I explain neuroscience.
There we go. Okay, so benzodiazepines are most commonly prescribed for anxiety, seizure disorders, and insomnia, and they might be prescribed for other things like generalized anxiety disorder, social anxiety disorder, epilepsy, panic disorder, tic disorders, and bipolar disorder. So those are some of the more common mental health diagnoses that's associated with them. Some common benzodiazepines are Xanax, Valium, and Ativan. And in the bottom right corner, we see a report of the FDA approvals for benzodiazepines. The FDA monitors the usage of drugs by approving them for some uses. Some benzodiazepines have multiple uses, but the graph further depicts the approvals from the FDA and their usages. So clinicians and researchers have not come to one single impression of whether benzos should be prescribed or not. There are many opinions and options alongside mixed research results. To demonstrate this, one stance is that benzos should be prescribed only after other clinical options are tried first. These other options are called first-line treatments. Clinical practice generally advocates for the use of first-line SSRIs and SNRIs for anxiety disorders before prescribing benzos. Another common clinical concern is the dependence the development of dependence on benzodiazepines. Some advocate for the short-term use of benzodiazepines if needed due to the long-term effects that benzodiazepines can have. On the other hand, some people wonder about if the side effects of benzodiazepines are any worse compared to the side effects of other options like SSRIs. But at the same time, there's a good base of evidence for the effectiveness of benzodiazepines for treatment of anxiety disorders. Starcevich 2014 reports that one study evaluated 2,300 patients with generalized anxiety disorder who used benzodiazepines and had a beneficial result from that treatment. Benzodiazepines seem to be beneficial because they have a rapid onset for therapeutic action. So for the basis of anxiety, it might be beneficial to use them on like an as-needed basis. Starcevich 2014 also reports on results from a systematic review comparing benzodiazepines with antidepressants in anxiety disorders, and that study found that there was no evidence to support the primacy given to antidepressants over benzodiazepines. So from this little review, there's a lot of debate on the use of benzodiazepines for treatment. Resulting from this, a number of recent editorials, commentaries, and debate articles have called for benzodiazepines to be revisited, reconsidered, or reappraised within the scientific community. So there's some evidence for the effectiveness of benzos for short-term treatment of anxiety disorders. These researchers, Guina and Merrill 2018, state that benzodiazepines have research evidence for treatment using panic disorder, generalized anxiety disorder, and social anxiety disorder, but not other disorders. At the same time, the treatment of mental health disorders using benzodiazepines is contraindicated for some disorders. Guina and Merrill 2018 report that benzos should not be prescribed for PTSD, phobias, depression, bipolar disorders, psychosis, neurocognitive disorders, and those with substance use disorders. There's also concern for the use of benzodiazepines in comorbidity with other drug therapy treatments like other CNS depressants, which can increase the chance of overdose. Benzodiazepines should also not be prescribed for those who have comorbid diagnoses in addition to anxiety. Guina and Merrill also report that benzodiazepines can worsen symptoms of depression. Moving on, when comparing the effectiveness of different types of benzodiazepines on anxiety treatment, Starcevich 2014 reports that there were no differences between Xanax, Valium, or Ativan in the treatment of generalized anxiety disorder. So overall, there's a lot of evidence for the use of benzos mainly in treatment of anxiety disorders, although there is a lot of controversy surrounding its use even with anxiety disorders. So part of the concern of prescribing benzodiazepines has to do with the development of tolerance and dependence on the drug. Guina and Merrill 2018 report that increased tolerance or diminished response to the drug is developed relatively quickly with benzodiazepines. The tolerance to the hypnotic, relaxant, and anticonvulsant effects can develop within days to weeks in users, and as a result of this tolerance development, dosages of benzodiazepines are increased after the first dose loses its potency or effectiveness. Benzodiazepines also have some concern for the development of dependence and abuse. So benzodiazepines have the potential for physical dependence, prescription medication misuse, recreational abuse, and addiction. Physical dependence happens in the presence of tolerance and or withdrawal symptoms. Benzodiazepines can be misused via recreational abuse, in which an intoxicating high is sought out. Combination of benzodiazepines with other drugs can be lethal, and that's not always recognized. Sometimes benzodiazepines are used to help alleviate unpleasant symptoms of other substances, like treating self-treating opioid withdrawal or stimulant intoxication. Additionally, Starcevich 2014 reports that those who are prescribed benzodiazepines and use them long-term should take caution if they are planning to stop taking them because of the withdrawal symptoms that can come up. Additionally, as a result of these factors, benzodiazepine withdrawal symptoms and syndromes are often portrayed in an exaggerated manner, and then it's dreaded by patients and physicians, which cause patients to continue use rather than facing withdrawal. This process reinforces the notion that benzodiazepines are addictive, so it's important for patients to feel ready for benzodiazepine continuation, and that's all according to Starcevich 2014. So in the graph on the screen, we see a report from Kaufman et al. 2014 and their longitudinal study based on data gathered from the National NHANES database. This data is reported as the percentage of participants who reported prescription drug use and the duration of their drug use. Results showed a general increase of benzodiazepine use from 1999 to 2014, and this general increase was driven by medium and long-term use. The level of short-term use was relatively consistent. This might be due to what was mentioned just before about physician and patient fears to experience benzodiazepine withdrawal. Another study conducted by Eschi et al. 2021 looked at retrospective data gained from Medicare beneficiaries from 2013 to 2018 and reported that benzodiazepine prescription did not significantly differ between any of the years reported. This is important because it shows that there was not a large increase or decrease in the rates of prescription in that time period. And finally, Milani et al. 2021 reports on the difference of prescription of benzodiazepines before and during the COVID-19 pandemic, and they found that overall benzodiazepine prescription decreased from January 2018 to March 2021, except for a slight increase in April of 2020 for women. So overall, these studies represent a trending time frame from 1999 to early 2021, in which they found that benzodiazepine prescription has increased moving into the 21st century, but that this has leveled out since approximately 2013. So to review what has been presented, we see that benzodiazepines affect the neurotransmitter GABA in order to slow down the central nervous system. Common benzodiazepines include Xanax, Ativan, and Valium, among others. And overall, we see that benzodiazepines are a drug classification with a lot of baggage in terms of perceived effectiveness versus symptomatic risk. As consumers, we should be careful to do our research before trying drugs recreationally and to be informed in care decisions. The use of benzodiazepines is also more common now in the 20th century, although it has leveled off in terms of prescribed usage. So here are some additional resources that have more information about benzodiazepines and treatment options for any dependence or withdrawal that could happen from usage. The names of these resources are the Alliance for Benzodiazepine Best Practices, the Benzodiazepine Information Coalition, and the Alcohol and Drug Foundation. For those who are concerned about the use of benzodiazepines, whether this is prescribed use or recreational use, they should speak with a primary care provider to gain clarity and assistance. Here are the scholarly references that I found to gather information on the treatment of disorders using benzodiazepines, the current trends on benzodiazepine usage, and the rates and concerns with dependence. And that's all I have. Thank you for